Hello, my name is Julie Larese. Today, I want to add evidence-based communication strategies to your soon-to-be new graduate nurse's tool belt. There are evidence-based communication strategies proven to resolve conflicts in a positive way, which ultimately leads to safer care of your patients. Let us choose to learn and practice assertive communication strategies. I promise this will make an impact on surviving as new graduate nurses. This is the overview of the content of this presentation. In this presentation, we will cover why effective communication is important. We will review a few communication concepts that you have already learned in your coursework. Do you remember the verbal versus nonverbal, the 4 basic communication styles? And for the visual learner, I pulled out the conflict resolution model. After a short review, we will dive into the meat of the presentation. The 2 strategies go by the acronyms of CUS and DESC. And yes, I am going to teach you how to cuss effectively. CUS stands for concern, uncomfortable, and safety. DESC stands for describe, express, suggest, consequences. Feel free to look at your handouts during this presentation. Unfortunately, new graduates have a target on their backs, and it is absolutely not right. As a profession, we have addressed the nurses eating their young phenomenon. It's gotten somewhat better, but I know it still exists. Maybe as a student, you experience some incivilities. We need you all to stay in nursing and also at the same time promote a better culture of safety and respect. Let's give you some tools to survive and at the same time practice advocating for your patients. In case you have not noticed, nurses engage daily in communication with patients, families, administration, staff, doctors, you name it. We are the glue that holds the teamwork together. Studies have shown how effective communication impacts patient care and how new graduate nurses can prepare for managing conflict. Look, no one jumps out of bed and says, I can't wait to encounter a conflict today with my supervisor, or I can't wait to be disrespected when I question an order from that surgeon or express concerns over discharge orders. The need to advocate and manage conflict arises frequently. Using evidence-based communication strategies empowers your message delivery. I have used CUS and the DESC script with excellent results. I choose to recognize where I need to improve and change, practice, and I learn better communication skills. And these are skills you can learn too. Patients confide in us. They trust us. They tell us things that they left out of the other team members' assessments. We are their advocates. We have the duty and the responsibility to effectively communicate their needs to the other healthcare team members. If not you, who? And what about your own health and well-being? You can make an impact on the environment you work in. Don't let a work environment stifle your potential to become that excellent nurse. Your patient needs you at your best. Let's work on these strategies, okay? But first, just a bit of a review is needed on communication basics. Here we go. Let's review those communication basics. Verbal and nonverbal review. What do you think are the percentages? For nonverbal, our vocal signs, the pitch, tone, and pace, versus the actual words we say. Go ahead and fill in the blanks, and don't worry, you're not going to be graded. How did you do? Only 7% of our actual words communicate our messages. How about communication styles? The assertive, and this is where we want to be, the aggressive, the passive, and the very dreaded passive-aggressive. You don't want to be passive-aggressive. It's the worst one you can be. Now, personally, depending on the context, I use all of these styles. However, when I put on my professional nursing hat, the assertive communication style is where I need to be. So which one are you? Reflect. Do you need to change? Do you need to learn new strategies? This is for that visual learner. I like models. Compromise is the goal. Don't be on the left side. That competition avoidance, you don't want to be there. Patient advocacy, patient safety, and a respectful work environment are our ultimate goals. Let me share some changes I intentionally make to improve my communication practices. I cross my arms often when I'm in cold air conditioning, and I live in the South, and I don't know why we keep the rooms at a freezing temperatures, but they do. However, as you well know, this can be interpreted as non-engaging. When in a professional communication moment, I make a point not to cross my arms. I intentionally practice a change with my body language. How about you? What messages may you unintentionally send? Okay, let's do this. Please reference your handouts to enhance my examples. First is the CUS approach. This is used to advocate safety concerns. Here are a few examples that just may be from personal experiences. Follow along and catch the keywords in my examples. This is the first example. I am concerned about floating to the cancer floor the first day off orientation as a new graduate. I am uncomfortable with the needs and care of cancer patients and have not been orientated to chemotherapy safety. I feel this is a safety issue for the patient and myself, and other options should be explored. Did you see the flow? It is recommended that you actually write out a script, especially if you're going to be nervous or stressed. So here's another example. I am concerned about the potassium order that my patient has been receiving for 2 days. I am uncomfortable giving this potassium. I feel this is a safety issue because of the decreasing renal function and the rising potassium levels. So what do you think? Fairly easy to use the keywords and construct an assertive communication strategy for patient safety. Next, let me introduce the DESC script. Here are a few examples. You all might relate to this first one. Can we talk privately? When you corrected me in front of the patient, I felt belittled and my confidence and credibility with the patient is shaken. Can you speak to me in private when given instructions? A private conversation would benefit my learning and improve my patient care. I can ask questions and explore improved behaviors. Did you track the DESC script that cued the conversation? Here is another example, and I will pause this time and insert the DESC for emphasis. First, describe the situation. I noticed when I walked into the patient's room after shift report that I see cluttered rooms. And then express, I am concerned that the clutter is unsafe for patient care and ambulation. And then suggest, can we discuss ways to improve the care of our patients? And then the consequences. We both want patients to remain safe. Now, a situation like this may actually reveal a root cause of a staffing problem. Perhaps more patient care aides could be hired. Or this may be a one-time incident because the nurse had 2 patients deteriorate during the night shift. A better culture of helping each other out when patients deteriorate could be addressed at the next staff meeting, thus identifying an opportunity to improve a culture of respect in the environment. Are these strategies something that you can practice? Do you remember the first time learning the skills of IV insertion? Maybe the first time you hesitated even going through the skin. But with practice, you got better, and you will get even better as you improve with experience. Communication skills are the same. Choose to change, practice, and learn. Enjoy this short movie clip to wrap up this presentation. Let us manage conflict assertively and advocate for our patients with proven, evidence-based communication strategies. Thank you.